So for more, I'd like to welcome in Dr. Omer Awan, professor at the University of Maryland School of Medicine and the senior public health contributor for Forbes. Dr. Awan, thank you so much for your time today. So I have to say, I think most people wouldn't be concerned about this, wouldn't even be a blip if we had not all lived through the COVID pandemic. How concerned should the average American be right now?
Not very concerned, Nichole, but certainly this is something to watch out for and something to monitor and be vigilant about because this is a very rare strain of hantavirus. Usually, if it was a normal strain, this cannot be transferred person to person. You'd have to have exposure to a rodent, and that would be it. That person wouldn't be able to transfer this virus to somebody else. But this is the Andes strain, which can be transferred person to person. So that makes it a little bit more problematic. But with that said, this is nothing like COVID or influenza for that matter. This does not spread as easily or as efficiently as COVID. So this really requires prolonged, sustained contact. You can't get this, Nichole, by just saying hi, hello, hugging someone. That's not how this virus works. So you really have to be with someone for an extended period of time to then be infected. So I hope that gives some reassurance and confidence to people about this hantavirus that's spreading.
Absolutely. All right, so let's listen to some of what we've heard from somebody who's on that ship.
I am currently on board the MV Hondius, and what's happening right now is very real for all of us here. We're not just a story. We're not just headlines. We're people. People with families, with lives, with people waiting for us at home. There's a lot of uncertainty, and that's the hardest part. All we want right now is to feel safe, to have clarity, and to get home. So if you're seeing coverage about this, just remember that there are real people behind it.
All right, so doctors, right now with people in at least 3 states are being monitored after being on that ship. Officials, though, again, as we heard from Natasha, say none of them are showing symptoms. So should we read that kind of as the so-called system working as it should?
Well, yeah, first of all, I have to say I feel for all these people. There's hundreds of people that are going through this. It's a hard and difficult situation. I can only imagine how I would feel or how my family would feel if we were on that ship. So absolutely understand all the concerns. But with that said, I believe that the World Health Organization is handling this very judiciously. I mean, very well. They're now looking for international contact tracing, and that's exactly what they should be doing. They have to look now, go to the United States and all the other countries and monitor the people that have potentially been exposed. They need to test them. They need to see if they, in fact, are positive for infection. If that's the case, they need to be treated. And then all those people who are in close contact with them need to be interviewed, need to be examined as well and tested. So this is all part of the public health protocol to ensure that everyone is safe. Again, the risk to the public is low, but this is more about international contact tracing, not necessarily widespread community transmission. So I hope that idea and thought is clear to everyone.
So I want to ask you just in plain language, doctor, is there still, though, a real possibility this could spread?
It can spread, Nichole, absolutely, because it can go person to person. But this is not a pandemic. And I hope that everyone understands that there are many factors that result or can cause a pandemic. One is how transmissible or contagious is the virus. This virus is nothing near as transmissible or as contagious as COVID-19, for example. Does this virus have the ability to mutate or change so that it makes it easy to infect human cells? So far, there's no evidence to suggest that this virus can do that. And then finally, what I want to talk about is this virus has been around for decades. The COVID-19, if you remember, was a very novel virus. Our immune systems were not used to this, and it was totally new to our immune systems. That's not the case for this. I mean, there have been outbreaks from decades ago with hantavirus and even the Andes variant. So that should give everyone a lot of reassurance and a lot of poise when, looking at this hantavirus.
All right. So I'd like to listen to 2 things next. First, the captain announcing, unfortunately, the first death, and then a passenger on why he thinks that led to major issues.
This is my sad duty to inform you that one of our passengers sadly passed away last night. I'm told by the doctor we're not infectious, so the ship is safe when it comes to this. Of course, it's a very, very sad circumstance that will have an effect on our operations.
So Captain announced that there was a death, which is very sad, and he said it was due to natural causes, and we are not infectious. This was relaxing at the time, but it was also misguiding us because this person had the virus before he got on the ship.
All right, doctor. So from your perspective, I mean, obviously, hindsight is always 2020, but do you think it was possibly a mistake to not immediately distance people on that ship?
Well, transparency obviously is the most important thing when it comes to public health. We have to be transparent and lay out all the facts and details when they're available to us. Now, I don't know how much information the captain had, and I don't know that anyone knows. So perhaps he was speaking based on the knowledge that he knew. So it's hard to really pass a judgment and to do things hindsight 2020 when we don't know all the information. But with that said, what I will say is that it's very important to be transparent. That's everyone deserves that, and certainly the people on the cruise ship deserve that, and they deserve to know what's at stake, what this virus is. That this is a deadly virus we're dealing with. This is, of course, it's nothing like COVID, but for those that have symptoms in the lungs, so if you're having chest pain, shortness of breath, you have fluid in the lungs, 1 in 3 of those will likely die. So the mortality rate, that's what we call for the amount that will die, is about 30 to 40%. So 1 in 3. So that's something that everyone should know. And transparency is the best medicine, really, when it comes to public health.
Wow, yeah, so 1 in 3. I mean, that is a pretty staggering number there. Last question for you. Who is most at risk here, and then what is the best defense?
Well, the ones that are most at risk are the ones that have had the most prolonged exposure with the virus. So that can be anyone, really. Anyone who has had prolonged exposure, who's in close contact with some of the people that are having symptoms, and obviously those who are elder, have chronic medical conditions like diabetes, heart disease, those who have weakened immune systems already, so they may not be able to fight the infection as effectively as someone who is younger and healthier. These are the people to really watch very carefully. There's no specific treatment, Nichole, for this virus. There's no antiviral medication that will really solve the issue or treat this disease. That's why it's very important for anyone who's showing symptoms to go to the hospital or to get medical attention immediately, because then they can get supportive therapy. They may get fluids or they may get oxygen therapy to help them breathe better. And that's going to increase their chances of survival significantly.
All right, Dr. Omer Awan, thank you so much for kind of walking us through all of that. Really appreciate it.
Yeah, my pleasure. Thanks, Nichole.